Kia ora, everyone. Thank you for joining, and we're really excited to welcome you to today's chat. And it's another one of our joint ventures, so to speak, with community research. So I want to just say I'm Tim Fadgen. We're here with Kayathri from the Aotearoa Migration Research Network. And with us today to introduce our speaker is our friend Bev at Community Research. So I'm going to hand it over to Bev. Kia
Kia
ora.
ora, thanks, Tim. I thought I'd formally begin with a karakia for us. Kia taonga manaakitanga a te mea ngaro, ki runga, ki tēnā o tātou. Kia mahia te hua ma kihi kihi, kia toi te kupu, toi te mana, toi te araha, toi te reo Māori. Kia tūturu, ka whakamawa kia tēnā. Huie, taiki. Let the strength and life force of our ancestors be with each and every one of us, freeing our path from obstruction so that our words, spiritual power, love, and language are upheld, permanently fixed, established, and understood forward together. So, ko Bev Chow Hong toko ingo, and I'm the Kaituhono Ethnic Research Engagement Lead at Community Research, and it's a real pleasure to have a further joint webinar with the Aotearoa Migration Research Network. The session we have developed up in two parts. So in the first segment, Kelly's going to talk about the integrated tree model and its development, and in the second part, some practical examples of its use. So after each part, we're going to have some opportunity for questions and reflections from the audience. So thanks so much for coming along to this webinar. So first, I'm just going to introduce a bit about Kelly. It is with real pleasure that we welcome Kelly to present at this webinar. She's the Chief Executive of the Asian Family Services, New Zealand's leading provider in culturally responsive mental health, addiction, gambling harm, and social services for Asian communities. They've experienced significant growth and transformation with services such as school-based mental health services, developing workforce equity initiatives, and pioneering innovative digital responses to gambling harm. And they also operate the proud pilot Wellington Asian Mental Health Service. Kelly was originally trained as a medical doctor in China and migrated to Aotearoa New Zealand in 2002 and later requalified as a registered social worker. And so she brings a unique combination of clinical insight, social practice, lived migration experience, and cultural leadership to her mahi. In 2023, she was appointed a member of the New Zealand Order of Merit for services to Asian communities, and her work involves those roles in providing input into government advisory groups and sector panels, and most recently, she has been appointed as a board member of Te Haringa Mahara, the Mental Health and Wellbeing Commission of New Zealand. So now I'm just going to pass you over to Kelly to hear from her. Looking forward to it.
Thank you,
Kia ora,
Bev,
Kelly.
and thank you for the invitation. And it's a great honor to share this our mahi and the integrated tree model with us, with all of you. I can't see all of you, but yeah, I'm sure you can see me. And yeah, so I think I will just get into it because it's the time is ticking. We have a lot to share with you. I have cut some of the slide already, but yeah, we'll get started, I think. So I will share. Hang on, I will share my. Oh, hang on, that's cool. Sure. Sorry, haven't used Zoom for a while. Can you all see?
Yes.
Okay. And because I can't see any of you, so the team will manage and let me know when I need to stop. You probably just need to talk to me, otherwise I can't see you. So
I will do, Kelly.
Yeah, you do that. So I'm going to share with you the integrated tree model that is basically Asian well-being framework that we developed in Asian Family Services for the over last 28 years. So myself, I joined Asian Family Services for the last 10 years. So this is before my time. They have this conceptual model, but only up to 2016 when I joined, we have designed a infographic design as presented to you. So imagine this concept is a metaphor of uprooting a tree from original country of migrant and to replant in New Zealand. It doesn't matter of you, first migrant, second generation, or third, or fourth. So you have the root that are from originally from your parents or grandparents as a migration. So we kind of use that as a journey to recognize some of the challenge in migration face for our people. So we also use ecological kind of a system to really putting a context in place, because a lot of our migrant, when they come to New Zealand before migration, it's a completely different environment and different society they're operating, different system they're operating, different work environment, different family and community, how they operate as a whole as well. So we have used a tree as represent the person. So the root is represent people's culture and belief and values. Where we normally say, the culture and beliefs, the worldview is almost like the your color of your eyeball. You don't see it every day, but that other people see it. But that drives your behavior and the way of your interactions and everything that you do as well. And then we move to the trunk, which is the ethnicity and gender that are you biologically born with. And people have a multiple, identities, and that's fine. But the trunk is something you carry, is almost like skin of the tree that you cannot change. It's like you could be even myself, like people look at me, you're Chinese, I get, ask where you come from, and you get discriminated when, covert, for example, and you get say, oh, go back to China and things like that. So you kind of cannot get rid of the skin that you probably carry, even you speaking perfect English like my children. They still look Asian. So that's how we say that's kind of a represent people's trunk, and we carry the as an identity as well. Originally, we had the branches, the leaf, and the fruit is more of health well-being, and so we kind of have a much simpler explanation of the concept as well. And so you can see the original thinking. So we have a wider public health approach. So we engage in the policy level and community. We screen for early interventions, and we kind of have a early access for our Asian helpline, which is culturally linguistic appropriate for clinicians that are qualified and knowing the culture of the people calling as well. And then we narrow down into the clinical intervention, which is the more counseling work, one-on-ones, group work, and peer support as well. So that's the 2016 version of the tree model. So then we evolved in 2025. We have done a partnership with Alan Clark, and this is the name of the official published research, transplanting and gambling risk, validate a culture responsive model for Asian migrant gambling harm. So that's a more kind of narrowed down into using this tree models, conceptual model, to really narrow down into a kind of gambling perspective. But also, this is I want you to remember, this is what you see is the new 2025 version of the new model. So we have a further developed this conceptual model as a well-being. So thinking about flourishing a tree, that you have everything that are perfectly fine, and you have all these beautiful things that are happening for this tree and to the person. You have your root, you have connection with your culture, your values, the way of thinking. It's healthy, driving you your identity and ethnicities, age and gender and personalities. And then your branches, we kind of further develop some of the concept as well. Your branches and your leaf, because we think people's life experiences play a significant part of their people's well-being, and education and language and skills that people build over time as well. And your working experience and all that counts as well. And so flower and fruit are health and well-being and personal growth as well. So when the migration journey happens, and we surely, if the tree is uprooting, there will be broken roots, there will be broken branches. A lot of migrants, you probably agree with me, even like Bei was introduced myself. I was a trained medical doctor. I was working in the hospital. When I come to New Zealand, I didn't speak perfect English. My qualification wasn't recognized, so I have to start again. So you've broken different things at different part of the tree that are continue as a new life in New Zealand, and that's define who you are, your well-being as well. But you also within the context, so we cannot forget a lot of migrants, they don't really know how New Zealand system works in terms of you have to rebuild your friend group, your close connections with your network. That's why we say the microsystem that are soil and water that's represent our close. And we sometimes as migrant, we cannot pack our friends into the suitcase. We cannot bring them with us with extended families. So we have to start again with this supporting network. And what happens if they don't have those support system? People falling loneliness, get discriminated, and they don't have support, or they feel depressed. And so all that like opposite from well-being for some like health issues as well. Then we go into the meso system, air and moisture. We need the better, all that to be growing as a healthy tree. And so that's your surroundings, your workplace, your schools, your neighborhood. And we know the more we grow and the more kind of as a society, a lot of neighborhood is not the same anymore. We're way probably back in the home, like you can run to your neighbor and to have a play date and things like that. It's not as a friendly as that kind of a where you grow up and where you come from. So you have to reconnect and rebuild integration of your community, and who are your community, how can you be part of it and feel belonged. And some people may feel like, we have the survey from last year, half of the people don't feel belong. And that's another thing that people feel lonely. And that's a number one that we know drive people with depression and other issues in life as well. And then we move to the microsystem, which is sunlight and temperatures and climate. Without those, you can't survive. So we're talking about the law, the policy, and the culture, the social norm. What's New Zealand's culture within we are operating as well in your workplace, in your friendship. In New Zealand, very classic example that I always gave is, here, in our a lot of Asian collective culture, when you host some parties or gatherings, you provide everything most of the time. And here is like a lot of times that you bring a plate. When you don't really understand the culture, we had a joke about, someone just bring an empty plate. And so why you ask me for a plate? Because, things like that, it's very classic. But we now know, like a lot of people will start learning. But that's just a tiny of an example that to show a lot of things that are really we're operating the health system that we're not familiar with. A lot of Asian countries that you probably, having a access point will be, you rock into the hospital, you get triage for different things. You're not really having this primary care and specialists and referral pathways of how New Zealand environment operate. And for the gambling harm is the same. A lot of countries that they don't have casino. Casino is illegal. But come to New Zealand, the environmental is legalized and it's 24/7. So you have a shifted environment. But also, I want you guys to remember, people come with different literacy on mental health addiction, and gambling harm and all that. A lot of people don't have the public health message about mental health well-being perspective. As New Zealand probably have done a lot of amazing jobs, like John Cohen's campaign about depression. Openly talk about overcome stigma. We, as a lot of migrants, in general speaking, carry a lot of stigma and shame. So again, those are the barrier for not on top of the language and culture as well. So I want to just you to remember that it's a kind of a model, but you when we come to this case study, I'll go through detail as well. So I want you. So Babe asked me to share about this study. It's a huge study, and I know some of you are researchers and maybe clinicians. You're welcome to read the whole report. It's a very large study. So I'll just pick some of the highlights from the research and to just give you a bit of a taste of what is this research about, and then we can have a bit of a discussion as well. So the risk factor for a particular Asian migrant, it does have for gambling, it does have a lot of tie. This is from a literary review that we have done. So luck and fate and some of the beliefs that are, people brought up with does impacting on the gambling harm part. And another very, very highlight is migration stress factors. A new country like that, loneliness, isolation, language barrier, and discrimination, emotional stress. Those are also the really driver risk factors for a lot of migrants with gambling harm and other mental health issues as well. So the study is combined with three phases. The first one is a literature review, very straightforward, 46 peer-reviewed articles, and have done that between the year they select. Phase 2 is qualitative interviews. We interview across different Asian ethnic group for 25 peoples who experiencing gambling harm, could be their own family members. Phase 3, we have a quant survey, which is a 1,200 plus, which is quite a large for Asian sample size as well. So again, it's quite a large study, and to come up with some of the conclusions and validation of the risk factor the model as well. So what do we? So we use a PGSI, which is a problem gambling kind of a index that you probably already know. I don't know. I don't need to go into detail. But we also look at demographic variables, and those we use gambling-related cognition scales as well, personality measures and experiencing measures, as well as environmental measures as well. And the approach they use for the study is analysis approach as well. So those are the very research terms. If you want to know more, there's all the details in the study that you can read as well. So we come to the really different ethnic. We know Asians very, very large population being lump sum together. East Asian, Southeast Asian, South Asian, and Asian New Zealanders as well. And so again, we know the East Asian reported lowest problem gambling rate, probably 1%. South Asian reported a much, much higher risk, which is almost 6% high risk and 11% moderate risk. Again, that is also very true from our presentation, from our referrals on a daily basis for many people seeking help for gambling harm from our service as well. So why people gamble? So why people want to gamble, right? Again, I think there's a mix of things that we ask, and you know, the perception, like we talked about earlier. You know, I'm lucky, I probably can win more money. Financial gain, motivation, about a lot of stress when the migrants come here. You know, the strong motivation of cognitive motivation as well. Perceive I'm lucky, but also some people is want to really escape their problems as well. For the excitement of and peer and social connections, and people goes to, you know, casino for a drink, and also loneliness does drive that as well. And again, you know, a lot of younger male will probably want to earn more money because they think they're more smarter than the machine. So again, so those are really really some of the details that drive people to motivate for gambling, but also it create a lot of risk for the tail bar is, you can see it's a high risk of gambling. Again, the most strong belief people have for the luck and the chance to win, the higher risk they become for gambling. So that's kind of very self-explanatory that you can you already have a look. And so on the environmental gambling harm, I think again we notice you know, early family environment that people have for gambling and normalize. But again, it's very, for a lot of Asian countries that we see, for example, in China, people do play mahjong, and which is type of gambling. So normalize the gambling, but between the fine line of gambling and gambling harm, again, people really don't have that literacy on gambling harm. So the earlier explore, like people get to know those gamblings with their family, probably the easy for them to say, oh, come on, it's fine. Like I just go to the casino, have a drink, have a play. So those are the really bring the later on high risk. You can see the tilt bar that goes up if people have a much you know, kind of a early exposure kind of an influence as well. And then again is you know, that's all the direct quote from the client that we interview. So everyone in my family advised me to avoid anything that would make me lose control of my life. But a lot of people would not to commit that they will be losing control. They say, I can gamble, I can stop anytime, and I don't need to be worried about like having any harm. But again, we know in New Zealand, I mean, around the world, that gambling is a significant, almost public health issue. People don't really know the poker machines are designed to be more addictive. That's why in our model we talk about the environmental stuff. Is in New Zealand is legal, clubs and pubs, and the whole industry is kind of allowed to legalize and people can access. And so we know the triangle of gambling is like you can access, you have time, you have the money, right? Triangle to really get into. And plus, Asian have a much significant harm in the Ministry of Health study in the couple of years ago is Asian have a 9.5 small harm for gambling harm than the general population. Again, it's very significant because those different beliefs and different systems they operating as well. And another thing I want to highlight here is we found from the study that advertising is actually one of the trigger for a lot of people to get into the gambling kind of a behavior or activities. So again, we are here in New Zealand, we are not banning any advertising. So advertising for lotto, which is also gambling, there's a bombard with the online, if you use social media like TikTok or anything that are embedded advertising. Now online gambling casino is illegal. Will be, there's a 15 online casinos will be ready up and running in December, be auctioned. Again, those advertising will be like tsunami to come into people's face, where we're kind of quite not ready for some of those challenges as a country as well. So again, those are the triggers, but we need to really looking at the environmental, but not looking at blaming the individual as well. But I know our study did look at some of the trend of the people's different, demographic, age, and all that. But we can be more supporting those people and targeting those people for the public health messaging as well. And again, looking at the personal, characters, like people might have a different higher risk takings and more kind of, we want to kind of not using compulsive, but kind of impulsivity of personalities. But again, we also have to not looking at individual blame, but also looking at the environmental as well. And the cultivation.
Just a couple more minutes, Kelly. Sorry to cut in.
Okay.
Just a couple more minutes to close off this bit.
Oh, okay. So, okay, I probably need to move faster then. So, yeah, the general bias of those luck and all that does contribute as well. So, again, you compare with the risk model that, gambling, it's who you are and what you experience and all that will contribute, and how you think and believe in your belief system as well. So, validated moment of the tree model is, again, the root is cognitive factors that people, drive people's behavior, and then the personalities with, the trunk that are people having those different risk takings and predicted factors as well. Branches and life stress, that the migration between 2 and 5 years are much higher risk as well. Education is one of the protector factors as well. So people with higher qualification, they might have a better protecting from gambling harm and better deal with life stress and well-being as well. And we found that on the well-being side of flowers and fruit, on the other side is people with gambling harm also are coexisting with all other mental health and substance use, or combined comorbidities, distress as well. Again, the influence of families and accessibility for advertising, all that environmental contribute in a much different space for people with gambling harm and mental well-being as well. Again, legalize the environment that are for people to have a 24/7. Nowadays, we have fun. People can gamble 24/7 if they choose to. Again, those are the really harmful moment for a lot of people. Implications, we need to have a better culturally appropriate services, prevention, intervention, hard industry, kind of industry means all gambling operators, including lotto up to online casino, so everybody in between. So we have a much stronger regulations, and we have a better support for settlement and social services and clinical interventions. And targeted health promotion is very important because we know many mainstream driven that doesn't really reach to our community. So this is research is kind of telling us some of the recommendations. I'll stop there, but I just want to acknowledge the people on the screen, so who have contributed to this study. It's a huge work. Yeah, so that's that. And so if you want to download the report, it's quite a couple of hundreds pages you can read. That's from the website there. You can read all the details that I didn't mention, or probably you want to know more. It's all there, so you can read it. So I'll stop sharing now, so we can answer some questions.
Kia ora, thanks so much, Kelly. There's a lot in there. As you were talking, I was thinking, this could be at least a half-day workshop that we could have as a focus on this. That
Yes.
was
so let's. So I pick up one gambling case and share for the child youth mental health services and peer support as well. But even for this reflection of the gambling case, it's not just gambling harm. It's mental health coexisting in everything. Even if you're a clinician, you can think about your own case when I talk about this as well. So basically, I mean, I'm running quite fast because I only have 15 minutes each of the slot. Like Bay was saying, we do have an e-learning module, which is not particular for this study, but we have a so gambling harm for different modules on our eLearn X, which if you're a clinician, you can access those trainings for free, and they are based for the integrated treatment model as well. And you can, that's probably about 2.5 hours, 2 hours to 2.5 hours self-learning for online modules. So this is very speedy, almost like speedy dating. So I'm like just going to zoom you with everything, and then you can digest later. So 6 steps, and so we have the tree model. If this is a ecological framework, it's not. Don't think about it's just a one assessment that you can just do it in one go. So it's pretty mapping out people's journey, and so kind of capture if you're working cross culturally, you don't miss out things that are people probably presenting as well. So again, recap. The root and the trunk and the branch and the flowers and the environmental, and so we can move on that. So just so you can remember, this is the tree model framework. If you kind of remember in your head when we're talking about those case study, that will probably give you some idea about thinking different issues at different point. So again, I want you to remember, so all this is you're dealing with a holistic person. The tree model is really kind of helping to organize your thought when you're doing the cultural assessment, and or align with whatever assessment you are doing. So in front of you, the person, you can understand where is demographic, the person coming from, their culture drives what they're presenting, and the life experience and the cultural well-being risk, and what people believe. Because sometimes the intervention, if they don't believe what you're talking about, you can't really move the mountain with the therapeutic intervention as well. So it's really mapping over time about understand the person, where they are and in what context. Because when people as a migrant, they might come like 2 years, 5 years, whatever years. They might be coming here like myself, 25 years. And there will be still things that I do that I operate within my original culture, but I probably integrated it, and then I'm moving from different part, depends on what things I do. So you kind of, again, when you're working with client, you cannot be, just fix the mind of having a particular, just one assessment. Try to be open as well. So using this as a map and beginning with, so I would recommend beginning with the trunk. So people, understand who they are as a person. And then because you need to really build the rapport, relationship. I think we say in Mari also says it's all about the people. And I think in a lot of collective culture, Asian is the same. It's all about a rapport, the relationship that you build. People can feel safe to open up and to start from like who they are, because you can look at them and beginning with a trunk, like, oh yeah, you come from here and how long have you been here? And so starting with those general questions is much easier than just get into a really hard question. And because when I say that, so currently a lot of primary mental health addiction services, a lot of Western model of way of design the form, like the Duke form that are currently used in the primary mental health system. The first question they ask, we have a lot of feedback, negative feedback. So it's like, do you like yourself? In collective culture, I never think about, do I like myself? It's also, that's kind of a huge conflict between how I view myself. How I view myself isn't matter as to how others view me in the collective culture. You almost have to be proven by someone else who is holding that manner. Again, those are the contexts that are within a lot of different people's culture and they operating. So again, some of the Western models, they put people off because then it's like, what are you asking? I don't really understand why you're asking me that. So I shut down with my response, because I can just, tell you anything. I get out of the hair. I don't come back with the DNA next time. So again, those are the really important things to be aware, which is cultural competency, cultural safety lens. And again, putting people in different contexts is important, because the environmental, like I said, when people come into New Zealand, they're operating a totally different environment, from the family unit up to the community, up to the society, up to the legislation and all that. It's a huge difference for them to understand how things work as well. And so that will be sometimes contributing the people experiencing harm, like gambling, which is very classic, and even some of those other accessibilities for drug and other form of harm as well in New Zealand. So again, explore some of those cultural identities, and but remember, I want you to remember, we talk about when come to the case study, the belief system drive people's behavior, the luck, the fate, and the gambling. But even so, some of the mental health, like if people are so shamed and stigma, those are driving their behavior for help seeking and saving face. I don't really think I have a mental health issue or mental illness, depression or anxiety. I don't want to be labeled, and I don't want to take the medication. I don't want to engage. Even, I have all those different challenges facing at me. But a lot of times people are facing in that way and end up in crisis. And that's some of the challenge that we are dealing with in the system in New Zealand as well. Do think the migration journey experience influencing some of way of the people's view on well-being and gambling as well. So again, people might have a really, really bad experiencing kind of a migration discrimination and bullying. You never know until you really understand what's going on, or even intergenerational trauma, and those are the things that are probably they carry, or the loss and grief that people carry, because as a migrant, you might lose your, people that are really, really important to you, and you cannot come back to do whatever your culture believes that you need to do, and you carry that grief all the time. And maybe, gambling could be your coping mechanism for zooming out to be, I don't want to think about anything because I feel so guilty. I lost my grandparents when I was migrant, and I can't go back. And there's so many of those people experiencing that go over covert as well, for example. And that's just one of the classic example. People are carrying a huge, grief and trauma in the different ways, and that maybe driving them to do another end of presentation. Could be depression, harm, gambling, harm, suicide ideation, all that, right? Again, where they add from their well-being definition, what they define with their well-being, what's their rituals of coping strategy with their beliefs as well. Some people probably have different rituals, like a lot of Chinese, they may go to acupuncturists and the belief of their well-being, how they deal with it first. that probably really important for this, discover. And so you can work with the client in the way that they really believe what it means to them about well-being and harm, right? So again, you cannot like just jump into, looking at the presenting issues and just using a Western model to just work on that as well. Physical, a lot of the times, physical, financial, social, all that is in the connection. So we need to look at people holistically rather than the really the current system really siloed and say, okay, here's your gambling harm provider, here's your mental health, here's your alcohol and drug. I know systems still operate that way, but as a clinician, I'm trying to influence all the people who are working with more collective culture. I mean, even mainstream. People need to be looked at as the person. What's driving the problem? What's the cause of the root of the problem that you can see as a fruit and flower? That's a presenting issue of the well-being. It could be opposite. It could be the good apple, could be the rotten apple, right? So what happened underneath of the drive? Maybe the person is lonely. You gotta really know those significant as a holistic rather than just any one of the singulars, right? And then we're looking at the context, which I kind of repeating myself. Those are the important part of the people's life, and so particular like put there as an example as casino and gambling and no support system for mental health as well, for example, and family conflict. And they normally probably have a lot of support in their back countries, but not now. They don't have anywhere they can go and trust it, and so they probably go to casino or those 24/7 place, which is all the venues that are not really so good for people. So let's, I'm just so mindful of time. Let's go to the case study so we can have I'll give you like each slide's 30-second rate. I'm not going to rate that for you, but if you don't want to do this exercise, you can think about your own client you're working with or anything you probably think of.
Are you sharing slides, Kelly?
Yes, I am.
I can't. We aren't seeing them.
Oh, really? Can you see
I'm
that?
not seeing them.
You can't see them?
No slides.
Can you see this? Oh, gosh. What's going on? Okay. Sorry.
All good.
Can you see it?
Yes.
Okay.
Now. Now. Yeah.
Oh, so they just stop by themselves. It's really interesting. Okay. So 30-second, read the case. Everyone finished? Okay, I'm just looking at the time. So this normally take like almost like a couple of hours to do. So I normally would ask people to go on have a discussion and come back using mapping out with the tree model. So, but we don't have that time. So I'm going to give you the answer. So the root, so Grubb strongly believe the fate and luck, which is again that drives the behavior. Oldest son again have a huge burden and pressure from the family. The beliefs that they sign, I don't have a problem as a sign of weakness. I don't want to help. Ashamed, you don't want to bring shame to your family as a collective culture. Like I said, It's not about you. It's how people seeing you. You kind of bring triple stigma and shame if you do that. The trunk, straightforward, Indian, male, 29, speaking Hindi and English, risk taker and enjoying excitement and competing, thinking he's smarter than the system. And have a responsible for his family's well-being, sending money back. A lot of stress for finance as well. Branches experience culture shock, loneliness, can't integrate it with all those communities as well. Gambling online is easy access, experiencing some discrimination, so even harder for him to interact like with other friends and maybe making more friends in the workplace as well. Experiencing anxiety, like the other person was asking, a lot of coexisting problems and even panic attack. Withdrawn socially and sometimes even drinking heavily to numb himself to after gambling and losing, you feel really depressed. So you can see, all that. If you follow that whole holistic approach, then you can see from the root up to the branch and the fruit and flowers, all the challenges as well. So what's happening in the environmental stage? I'm willing, to get to discuss his struggling, not knowing the cause, avoiding gathering, didn't integrate with the people who are in New Zealand, and didn't make a lot of trusted friends. High pressure, online gambling, advertising is, great offer, escape the problems and stress, and easy access for gambling. Don't want to seek help because of shame and stigma and lack of trust or awareness of all the services available as well. Gambling is okay, it's normal, lies in New Zealand, but he doesn't have the, addiction or mental health literacy on the harm side. So again, a lot of pressure on the finance part and sending money back to home as a duty of the collective culture as the oldest son. Again, those are the drivers that are a lot of factors that are he's carrying, and really understanding that cultural background and migration experience is important for people. So again, we will do if it's in the normal workshop, we will do a lot of reflection. We will skip that. I want to also share with you our Keoraki service, which is a school-based well-being services that we run different services. So the different way we're using it, we're using the tray. I'll skip this. We run the group work as a well-being workshop in the building flourishing friendship and emotion, unlocking superpower. So in different module that we run in schools, so we're using tree model as how people see themselves as a children. So we work from 5 years up to 13 years old, from year 1 to year 8. So we ask the children to draw their their own tree, and to really using our model for them to understand where things at, how can they get to the flourishing tree. So this is our tamariki, so which is amazing. They love it. They really understand. It's easy to understand, to mapping out your kind of yourself and your environment. So again, this is a very easy model to adapt and to use. We have a lot of good feedback from the schools and from the funnel as well. And the student write a lot, hundreds of card for our staff as well. So I was going to show you this video, but I don't think we have time, babe, right?
No, is the video available through a link which we can give to peeps to watch in their own time?
Yeah. So I'll give you this link. It's on YouTube, so you can watch it, which is a live experience video that people talk about. Even they all grow up in New Zealand. There's a lot of identity and challenges for mental health, addiction, and well-being. So yeah, that's just good to watch. So you can have that. 7 minutes. I think I better stop there. Yeah.
And is the link to the research that you mentioned on your homepage on the Asian Family Services site, or is that a separate thing?
Yeah, no, it's on Asian Family Services side. Research and resource and research is there.
Cool. So I've just put the link to the Asian Family Services website in the chat for peeps. Yeah. Thank you so much, and sorry for such a rush, but actually, I think it's been great to get that.
Bit rush, yeah.
It's been rushed, but it's also given us insight as to the breadth of the different things and the different ways that the model can relate to
Yeah.
different situations and contexts, and that kind of holistic complexity, really, that it's nothing is isolated, it's all linked together. And I love the example of talking us through how those different aspects of the model related to that situation in the gambling space. Just, yeah, heartfelt thank you again, Kelly, for taking the time to bring together this presentation and then presenting it to us here. A lot of interest, a lot of insights that people have gained from what you have said, and I think for myself, a lot that I will be following up on as well. And your site has lots of resources and the range of activities that Asian Family Services provides. So were there any other comments that, Tim, you needed to make as part of housekeeping at all? Otherwise, I will close us off with a closing karakia.
Just on behalf of the network, Kelly, thank you so much for that. It was really interesting, and we look forward to reading some more of the report and engaging with the learning. Kia ora.
Thank you. Thank you for having me.
So, kua mutu a mātou mahi mō tēnei wā, mana kitia mai mātou katoa, o mātou hoa, o mātou whānau, aio ki te aorangi. Our work has finished for the time being. Protect us all, our friends, our family, and peace to the universe. Kia ora and thanks once again, everybody. Ka kite.
Ka kite.
Kia ora.